question is, how could FoundationOne, change the treatment options or help patients that have maybe failed first, second, third line therapy? They have metastatic disease. What comes next? Oftentimes, for the most part today, those patients are relegated to broad-based chemotherapeutics. Certainly sometimes there's a benefit, but oftentimes there's not a benefit, and there are significant side effects that typically go hand in hand with these broad-based chemotherapeutics. We know that. It's something that we as an oncology community have been working through for decades. Let me turn to the data to really answer the question about how FoundationOne and how this technology can be used. And there's data that we've presented a couple of times on a set of patients with non-small cell lung cancer. So we have data on approximately 95 patients with non-small cell lung cancer. And what's interesting is that we found alterations in 33 genes in those patients. So that's kind of scientifically interesting, but okay, what does it mean? Well, if we take the next step and then say that 22 of those genes that were altered can be directly tied to a therapeutic that is either on the market or in clinical trials, you start to say, okay, well, there aren't that many targeted therapeutics for non-small cell lung cancer, so what's ultimately what is the benefit of that? Here's the benefit. Today, there are 3 tests that are routinely used for patients with non-small cell lung cancer in the community: EGFR, KRAS, and EML4-ALK. If you have a patient that tested negative for those 3 biomarkers, they are relegated to broad-based chemotherapy. Number 2, if you have a patient that has failed their first targeted therapy, their crizotinib, and their next option is a broad-based chemotherapeutic, do you want to know that there might be an additional 20 drugs that are either in clinical trials or on the market that could potentially be helpful to your patient with that disease? That's the way to think about FoundationOne. That's the way to think about this next wave of molecular testing. It's going to open up new doors for patients and for oncologists to select therapeutics in a very rational setting and utilize it for their patients.